Hi, everybody. I'm really excited that you all are here. For those of you who aren't from the area, we're actually experiencing a really bad snowstorm, so that's why I'm kind of presenting virtually rather than being in a center setting, which is where I would normally be. So I really appreciate everyone being here regardless of the weather and attending online, and I'm really glad we're able to use this communication to do this presentation. So just to start off, the CEU event is being presented through Verbal Beginnings. We are an applied behavior analysis company providing therapy and consultation throughout Virginia, Maryland, Delaware, Pennsylvania, and the Washington, D.C. area. Verbal Beginnings is an accredited behavioral health center of excellence and is an approved ACE organizational provider through the BACB, which is why we're able to do this presentation and all the CEUs that we've done prior to this. So a little introduction to myself. My name's Shannon Fitzpatrick. I am a BCBA. I've been with the company for almost 2 years now. I work in the center setting. So I work in early intervention in a center setting. I've previously worked in-home, and actually the company that I came from prior to this had a huge focus on multicultural training, multicultural services, and providing ABA services to a really diverse population. So my background is kind of being trained in this area, and that's why I am passionate about it. Additionally, on a more personal level, my mom immigrated here from the Philippines, so I have kind of that background of experiencing multiple cultures growing up, and is also part of the reason why I am really passionate about this topic. So I felt that that was kind of an important aspect of me to know as I'm presenting. And I really, love working at Verbal Beginnings and love the fact that I have this opportunity to disseminate information in this way, and that we have such a big focus on us being active participants in the dissemination process as we grow as a company. And I just love, collaborating at the center. Shout out to all my center people that are here. But I love the environment that I work in. I love all the opportunities that we have at Verbal Beginnings. So we're going to go to the next. Okay, sorry, we're on the current slide. So a little bit more about Verbal Beginnings. Verbal Beginnings is dedicated to providing compassionate care and effective treatment. Our mission is changing lives, one child at a time, one professional at a time. We aim to achieve these goals through our core values, which are collaboration, innovation, inspiration, education, and dissemination. You can see that on the right side. And then here on this slide, we also have contact information for Kat, who is my co-host. You heard her voice earlier. She's the person that you're also going to be contacting throughout the presentation if you have any questions, but also at the end of the presentation, if you want to know more about Verbal Beginnings, if you want a copy of the slides, if you want to know more about our future CEU events. She is a great person to be in contact with. She has a lot of information, and she can connect you to the right people if you have any questions. Next slide, please. All right. So a little bit more about Verbal Beginnings for those of you who aren't a part of our company. I know a lot of you are, but we were founded in 2011, and we provide ABA therapy in the home setting and in the center setting. Over the course of 7 years, we have expanded from our in-home services into multiple states, and we've opened up the Verbal Beginnings Center, which houses our early intervention, feeding therapy, social skills, and now we have New Beginnings, which is our new diagnostics program. So we have a lot of really great things going on at our company. We're a family of around 100 RBTs and 50 BCBAs, and we really work to change lives every day. We're all very passionate about ABA and the effect that it has in the real world. And part of this presentation and the reason we do provide these CEUs is to kind of adhere to our core value of dissemination. So that's really why we're here today, but also kind of the background to why, who we are and why we do what we do. Next slide, please. All right. So for this presentation, I would have loved to be in person with a lot of you and have really great discussions. This is a topic that is going to probably evoke a lot of questions, a lot of ideas, a lot of reflection. It was really important for me that we have opportunities for discussion, even if we're not meeting in person. So what we're going to be doing is doing breakout sessions. And as a little caveat to, talking about the discussions here for my presentation, this is a topic that can bring out a lot of, feelings, emotions, a lot of reflection, a lot of uncomfortable feelings, especially with the state of how things are just, in our world right now. But it's a really important conversation to have, and it's a really important topic to discuss. So I really want to encourage everyone to, come into these discussions with an open mind. Don't be afraid to ask questions, but also, make sure your questions are coming from a place of wanting to learn and wanting to reflect rather than, wanting to antagonize or start like a really, controversial discussion, because, these topics are, ones that can bring out some of those things. So just keep that in mind in your discussions, but I really want everyone to actively participate. So the way we're going to be setting these up is we're going to be doing what we call breakout sessions. So when we do a breakout session, what that means is Kat is going to be separating you guys into rooms for small groups, because if we kind of did this discussion with 50-something people, it would be chaotic. And I think it's much more productive to have these in small groups. So we're going to be breaking people into small groups. And when you do break into a small group, I'm giving you kind of this heads up because it is going to be timed. So make sure you're kind of not wasting time in the beginning. The first thing you're going to want to do is to select a leader or volunteer for it. And that person is going to be taking notes. And the reason for that is once your small group has ended, that leader is going to be messaging Kat using the chat function. And they're going to send a concise message with the notes or kind of like talking points or the main parts of your discussion, or you're going to volunteer to read it to the group. So you can message Kat and say, here, can you let everyone know this is what we talked about? Or you're going to message Kat and say, hey, I want to like verbally talk about what we discussed. And then you can then present to everyone what your group talked about. During these breakout sessions, you're going to be completely separate. So what that means is you're going to be kind of secluded to your room. You won't have the chance to chat with everyone at this point, but what you can do is you can find the button at the bottom of your breakout room that says ask for help. And either myself or Kat is going to come to your room and help you out. And that's, if you have any issues with the technology, if you have any clarification questions you want to ask or anything that you're not sure if it's a good idea to talk about or not, anything like that, feel free to ask for help during that time. And with this breakout session, discussion portion, just keep in mind that we're presenting using Zoom for the first time. And we have a lot of more attendees than usual because of the fact that I'm not presenting this in person to a bunch of people. Everyone's online. So there's a lot more people than we expected. So there may be some kinks we need to work out. So please be patient with us. Kat's kind of the person in terms of the technology aspect that you're going to want to contact directly if you're having any issues during the presentation. So after a few minutes, when you're in these breakout rooms, the breakout rooms are going to count down and then they're going to close. And then Kat will present each group's ideas afterwards to kind of talk about and spark some discussion and reflection and things like that. So if you have any questions about the breakout rooms, just go ahead and message Kat about that. All right, so my objectives for this presentation, one is that participants will identify components to multicultural sensitivity and ABA practices as they relate to multicultural awareness and psychology. So multicultural and diversity topics are not something widely researched when it comes to ABA. They're much more researched heavily in the field of just general psychology and those related fields. So we are going to talk a little bit about those other fields. Participants will determine how multicultural awareness and sensitivity relates to social validity and how social validity can differ from social norms. Lastly, participants will identify specific strategies for implementing multicultural awareness into everyday practice, specifically for intake assessments, client programming, and goals and family training. And I think this is the part that everyone's the most excited for. I think it's probably the most important part of this presentation, because it really, I really wanted to kind of dig into how we can apply a lot of the things we're going to be talking about into our practice every day. Because I think that is really, really important. All right, so just kind of a brief outline so you kind of know where this presentation is going. First, we're going to just talk broadly about multicultural sensitivity. What is culture? Comparing sensitivity to competence in this aspect. Aspects of culture that are important to keep an eye out and be aware of. Next, we're going to go into importance to behavior analytic practice. So it's kind of like the so what of this presentation. So why is this important? What aspects are important and what should we be aware of when we think about our behavior analytic practice as a whole? We're going to be talking about the professional and ethical compliance code for behavior analysts, the codes that kind of relate to this presentation, the different areas of importance, and then we are going to dive very briefly into systemic and institutional diversity and multicultural competence. This section could be its own presentation. I found some really great stuff when it comes to institutional diversity and competence, but we're just going to touch on it briefly. And then we are going to then talk about social validity and multicultural competence. And next slide, please. And when it comes to the area of multicultural competence, I kind of created these five strategies that I feel like are really important when kind of being aware and sensitive in your everyday practice, and then how these five strategies then can guide your assessment, goal development, intervention, and family training. We're going to finish off with some case examples. I really hope we have a lot of time for this. So, because I think these case examples really help us apply what we've learned. And then we're going to kind of wrap up and do questions. We have about 55 participants. So I'm going to ask that you keep your questions to the end, but definitely make note of them, and hopefully we'll have enough time at the end. If not, you can always get my contact info from Kat. If we end up not having any time to do questions at the end, you can definitely get my email address and we could start a discussion over email, and I would love to do that. So definitely jot down anything that you think of that you might want to ask at the end. All right, next slide. So what is multicultural sensitivity? So this is kind of going to be the broader aspect of my presentation. What does this entail? What are the different definitions? What are the things we have to keep an eye out for? How do we define this? And there are a lot of ways to define it. Next slide. So first, what is culture? I think this is something that, and if you go into any different field, they're going to have a different definition for it. If you ask one person versus another, they're going to have different definitions for you. But these authors here, Sagai, O'Keefe, and Fallon, created a definition that kind of brought together a lot of different disciplines. So they looked into psychology, sociology, education, a bunch of other disciplines, and they took these areas of study and their definitions, and they came up with kind of a broad definition, which I think we can all pretty much agree on, which is that culture is a group of individuals with similar customs, beliefs, language, religion, and patterns of behavior. So I think it's really important to take all those things into account, but I really like that they added patterns of behavior, because that is what we study, right? And I'm going to go a little bit more into detail later, but if you think about it, we all know we're shaped by our environment. And one of the factors of our environment is our culture. That's a huge part of our environment. It's a huge part of anyone's environment, how they grew up, where they're from, their customs, beliefs, and that over time shapes our behavior. And so that, is one of the core reasons why this is so important. So we're going to start with a breakout session. I know it's kind of early on in the presentation, but I think it's really important to kind of get like a pre-test kind of discussion going. Before we dive into anything deeper, what have your experiences been? So how many of you have worked with a client from a different culture than yourself, and how did this experience shape your experience as a clinician? What was challenging, different, or eye-opening about this experience? So that's the question that we're going to be discussing. Kat is going to break you out into rooms. Again, as a reminder, you're going to be automatically assigned to a room. The first thing you're going to do is assign a group leader, ask for help and send us a message, or ask for help if you need any help during the time. And then once the breakout room is done, you're going to message Kat directly to offer to read out your notes or to send her your notes so she can read it out loud. So I guess we can go for it, Kat. You ready?
Yep, I'm setting them up. All right, I'm going to open all the rooms. Now, if for some reason you aren't assigned to a breakout room because Zoom is bugging out or whatever, we'll just make one in this main chat for anybody that doesn't get into one. All right, is there anybody still in this main room with me? I can unmute you guys. All right, everyone has been unmuted now. So if you didn't get an invitation to join a breakout room, we'll just discuss it here.
So I'll go ahead and get us started, Kat, while you gather answers from everyone. If you haven't already, please message Kat. Can you guys hear me? Okay. My mic is on. Okay. So our group discussed a couple of things. So one of the things we discussed is kind of working on targets where the client has no previous exposure to it. And a lot of people's examples were that they had already started teaching a skill or a target, and then they found out later from the parent, well, that child has no exposure to this, or they have never experienced that, and that's not very important for us to learn, for them to learn that. One example was a Christmas tree. A family didn't celebrate Christmas. Another was, a client's family didn't eat sandwiches, and they were trying to teach him sandwiches and ask him questions about it. And then we also had a couple of examples. One was of, a family where there was a huge language barrier, and that made things difficult when that person who didn't speak English provided attention to behavior, and the person didn't know what they were saying to them. Another example was, I had an example where privacy was really important to a family culturally, and so they didn't allow us in certain areas of the house for in-home therapy, but then the client would elope to those areas. So that was also challenging. And then we also had an experience where, there was part of a family who was in kind of denial or didn't like talking about the autism diagnosis, and that was also very challenging. So we had a lot of experiences that were challenging, which I think, kind of speaks to the fact that everyone does have these experiences. And I think other groups are going to have other examples as well. Kat, did you want to share some of those or open up the floor to anyone?
Yeah, so I'm just going to go in the order that people have been messaging me. So Christina Restrepo's group 4 said that they all agreed that this is something they encounter a lot in the field, both in home and in schools. Some of the members of the group talked about navigating cultural interactions in the field is something that they encounter all the time. So they gave an example of rejecting food from families raises ethical concerns, yet that's something like, I think other people have said is a level of respect for a lot of families. So that was their thoughts. The group in room 5 gave some examples. Again, one family who wanted to serve drinks and food because it was customary, and they found it really offensive to decline the drinks. So their solution was that they came to a compromise that they could accept the technician or the therapist could accept water, and the family was able to appreciate that and roll with that, which was nice. They mentioned that it was difficult to navigate the ethics code about what families see as tradition and norms. But they try to meet families halfway to abide by the ethical code without, disrespecting them. So even just gestures like taking the water or tea and making sure that they drink it in front of the family. And then they also mentioned, things like language barriers that can kind of complicate that situation a little bit. And making sure, is another solution to make sure that the families are on board with ABA and understand the difference between things that they may think the client knows, maybe in a different language spoken at home versus in the language that you're teaching in. And also, when it comes to targets and things, there's socially significant skills and traditions. So they wanted to make sure, they pointed out including the traditions whenever possible, prayers before bed or meals as part of programming. And that also helps families, get on board and feel respected and understood, which might make them more flexible with other things that you can't necessarily accommodate.
That's a really good point.
James said that their group discussed just interesting perspectives on working in a new country, because that can be really difficult and important to learn what's considered appropriate or normal for the families on just a completely different playing field than you're familiar with. So not just kind of the micro going into a home, but, literally being transported into the whole other culture. So that was interesting as well. And he also said that Nikki mentioned the importance of teaching goals related to the culture, like how to address other people, which one's the first name or the surname, since that can be different depending on the family's culture. And as English speakers, we wouldn't think about that. Sherry's group also talked about a family who was in denial about diagnosis due to culture, kind of like you were saying, and, teaching utensils, but the family only ate with finger foods. And so that was, something that had to be implemented in programming. And Diana's group talked about kind of addressing the language barriers and communication barriers that other groups have mentioned, having therapists leave like handwritten notes, or making sure that they communicate. If mom's home with the children the most, the therapist had to only communicate through the dad because he was the one who had those communication strong points. So that's what I got, from people who have messaged me, but we can take a couple minutes still if, anybody if their group didn't get a chance to share and you guys had some thoughts, feel free to throw them out there.
Yeah. Well, while everyone's typing, and if anyone wants to get any last minute, stuff in the chat, Nikki made a good suggestion in the chat. I don't know if everyone saw it, that when we do breakout rooms, it might be a good idea to grab some headphones so that I know some of you may have experienced kind of the background noise and the echoing from other people's speakers. Yeah, making sure that if it's available to you to kind of grab some headphones, that might be a good idea for the next breakout room. Stacy said, I think walking the line with what to wear can be hard with some cultures. Yeah, I think that's a really good point. Clothing is one of the, I'm going to share kind of a list with you guys of things that can kind of differ between cultures and things that are important to keep in mind, but clothing is definitely a big one, especially because we, have kind of a different dress code. So sometimes we want to be really comfortable, but we also want to be respectful of other people's cultures. She says, for example, I want to match the approved clothing, but if it's 100 degrees out and long sleeves and a long skirt for an outdoor camp is hard. Yeah, exactly. So being respectful. And I think that's one of those things where you definitely want to ask. You want to ask the appropriate questions. Don't be afraid to step on anyone's toes. But if you really need to know what the dress code is, it can't hurt to ask. I think a lot of times people avoid those questions because they don't want to offend someone. But sometimes, most of the time, I think people appreciate it because they're like, wow, you really care and you really want to know. Lisa said, I made sure to look up what certain ASL signs were culturally offensive. Using the bathroom sign is inappropriate in some cultures, right? So that goes into a point I'm going to make later about not making assumptions based on something you might have researched about another culture. Julia said, I have to take my shoes off when coming into the homes of some clients. I think we've all experienced that. I have a no shoes home too, so I get that. So that's definitely something I keep in mind as soon as I step in the door of anyone's house. I'm like, do you want me to take my shoes off? Do you care? And sometimes even if the person says, oh no, it's okay, leave them on, but I know that that every other member of the family has taken their shoes off, I might do it anyway, just to show, I want to be like everyone else in your house and I want to respect that. Yeah, so Jenna also kind of chimed in with, I've heard of in-home families being offended that techs didn't know to take their shoes off. So yeah, that's, like I said, that's something I've learned over time, to just always look and ask as soon as I walk into a home. So I think that's can be an important part of this.
I'm sorry, it's Jenny. I'm just gonna pop in. So in the field, we do have certain policies though regarding safety.
Mm-hmm.
And so our first line of kind of what we do is shoes stay on for safety purposes, unless we know that the family has a cultural, religious, or otherwise need for us to remove them.
Gotcha. Okay, yeah, that's good to know. I didn't know that.
Yeah, so it's a safety issue, right? So we have some runners, or we've got kids that throw things, and there's potential for us to injure ourselves if we're not wearing shoes, or for us to injure, not to be able to do our job effectively. And so we try to be really sensitive if a family does definitely, for their cultural, religious beliefs, want us to remove our shoes, and we will make those exceptions. But our sort of our first assumption is to keep our shoes on for those purposes. But we do think of it as a case-by-case basis.
Yeah, that makes a lot of sense. A lot of people are chiming in here. Renee said we always brought indoor shoes to change into. Aaliyah said that not wearing shoes can be an OSHA violation. And Nikki said I had indoor shoes or slippers for when a family, when we had to keep them on, but families didn't want to. So I think that's a kind of a good compromise to think about. But again, like Jenny said, it's case by case. Someone said in our last company, we asked families to provide shoe covers for our staff, or gave staff the options of having home shoes. So it sounds like people have found really good compromises for that. All right, so we're gonna move on to the next slide, Kat. All right, so here is a definition that I kind of gathered from, and there can be lots of different levels when we talk about the differences between knowledge, awareness, sensitivity, competence. I've kind of used some of those terms interchangeably, but sorry, okay. So when we look at cultural knowledge, so that can be something that, sorry, I had to get headphones. Cultural knowledge, the definition here is knowing some cultural characteristics of another ethnic or cultural group. So that's kind of just that basic awareness, just knowing that there are differences, being maybe aware of some of those differences. Cultural awareness is kind of that next level in this definition that I found, and that's being open to the idea of changing cultural attitudes. So knowing that there are certain attitudes towards different cultures, being open to kind of changing your attitudes about certain cultures, and that level of awareness. The next level is cultural sensitivity, so knowing that differences exist, but not assigning values to those differences. So making sure that you're not thinking one is better or worse, one is good or bad. And at this level, I put here that conflicts usually occur. And what I mean by conflicts is when a member of a group, if you have an organization, if you have a company, if you have a school, if you have a group of people, and some members of the group are sensitive and others are not, that's kind of the difference between sensitivity and competence in this particular definition, where people can be culturally sensitive and know that differences exist, not assign value to them. But if you're in, a part of our larger group where not everyone has that same sensitivity, not everyone has the training, the background, the knowledge, that's when conflicts can occur. And those conflicts can occur within oneself if you're kind of struggling with an issue of multicultural sensitivity. It can be between people within an organization or company. And then it can be kind of system-wide, like, if a company or an institution doesn't make some of these efforts to become culturally competent, then it can create those conflicts. And these conflicts can be conscious, they can be unconscious. So just keeping that in mind. And cultural competence then is bringing the previous stages together to create operational effectiveness. And this just means that, a group of people, an organization, an institution, has policies and systems in place to produce better outcomes. So it's kind of that last step where you bring all those things together and make sure that system-wide you're engaging in these culturally sensitive behaviors and understanding these cultural differences and not assigning value to them. Competence requires vast knowledge and experience in dealing with multicultural issues. So by no means do I think that all of us attending this one, presentation makes us all competent, but we're kind of working towards that, right? And so, seeking out training, creating initiatives, like those are the types of things that can get any organization or any group of people in our field or outside of our field to a level of cultural competence. All right, we're going to move to the next slide. So aspects of culture to keep in mind. We're definitely set apart. And again, Jenny, you can feel free to chime in because I don't work in the field right now. So I have in the past, but if there's anything that I say that kind of clashes with maybe something that has been put into place in the field, let me know. But, in general, our field is set apart from other clinical practices in the sense that most of our work is done in the field and in the home. And so in that way, we're set apart and we are brought into very close contact with aspects of culture that someone who sees a kid in a clinic setting or in a center setting might not have as much exposure to. And I'm sure anyone that works in the field or has in the past can speak to this, but you're definitely brought closer to the idea of food and ceremony around meals, religious beliefs and sacred items in the home. So I'm sure, we've all been in homes where there might be even there have been some in my home, when I was growing up, statues and flowers and kind of shrines and things of that nature that you might see and not know much about. Gender roles is a big one. Gender roles is something that's ever shifting in, our culture here in the United States, but it's something that's vastly different when you go to another country, you go to another place, when you are exposed to someone of a different background. The roles of family members, particularly multi-generational families. So some people spoke in our last breakout about the fact that grandparents can be a big part of a child's life, particularly when you look at Eastern cultures and a lot of cultures that really emphasize having those multi-generational families in one home. So having the grandparents live in that home, even if they don't live in the home, having them be a primary caregiver. So the importance of that. Celebrations that a family might engage in, and then clothing. We kind of spoke about that with the shoes. We spoke about that. Someone in the chat also mentioned wanting to make sure she adhered to a family's, kind of their culture's dress code or their expectations when it came to clothing. So all of those things we do tend to have direct exposure to, really, especially when we are in the field. So these are all kind of things to keep in mind when you're thinking about aspects of culture that can affect your practice, and that should be something that you keep in mind when you are working with a family. All right, so we're going to jump into now the importance to behavior analytic practice. So we know that I think we all could see from our breakout that we have a lot of exposure and a lot of experiences working with families of different backgrounds. We, define culture. We talked about what aspects of culture to keep in mind, how we can be culturally sensitive and culturally competent, but why is it important in particular to us as BCBAs or us working in ABA is kind of the next part of this presentation. So on the next slide, you'll see I just listed out, it's very wordy, I apologize, but I wanted to get everything in there. So I'm not going to go into too much detail about these, but there are 3 particular codes in our ethical compliance code that address diversity. And the first one is making sure that when differences occur that interfere with your practice, to make sure that you are seeking out consultation and supervision regarding these things, and making sure if you can't address these things that you're making the appropriate referral, not engaging in any discrimination based on age, gender, race, culture, all those things, and then making sure that we're not knowingly engaging in behavior that is harassing or demeaning with persons based on their culture, gender, religion, all those, diversity, all those things. So those kind of just obviously are very important for us as behavior analysts to keep in mind, and that's kind of part of the so what of this presentation. Well, it's part of how we need to operate as behavior analysts according to the board, so very important to keep in mind. On the next slide, then I get into, we get into more details of the areas of importance, specifically why it's important to our practice. So when we think about environment, like I said in the beginning, our behaviors are shaped by our environment. We all know that. That's what we study. That's what we do every day. But if we're not really in tune and we're not aware of our client's environment, down to the intricacies of how meal times are, how, rituals that are done in the home, how clothing is important, how, all those things I listed before, we can't be expected to address behavior in that environment. Sure, we know reinforcement, we know punishment, we know extinction, we know the basic principles of ABA, and they do apply to everyone, but they don't apply to everyone in the same way, because we have to kind of meet our clients where they are in their environment and really understand that environment so that we can effectively change that environment if we need to in order to get, our clients to where they need to be. So this environment includes who's involved. Are there, again, multi-generational families in the home? Are there rituals, habits of clients and the caregivers that we need to keep in mind when thinking about how we're going to shape that environment, how we're going to shape the behavior and use the environment to shape that behavior? I have here, being aware of one's cultural identity allows for an awareness of how your beliefs, values, and environments differ from others. So yes, we can go into a home and say, okay, this is how this is how it is in this home. This is the rituals that they engage in. This is how they have, their meals, and this is how their family operates. But we also need to have an understanding of how is that different from me? How am I, as a person with my background, going into this situation and, knowing that my beliefs and my values are different, how can I then meet my client where they're at? So it's really important not to kind of disregard the fact that what we believe might be very different, and what we value and how we feel might be very different from the families that we work with. And that awareness is really important when we look at the client's environment. So then we have motivation. So if we're thinking about, the principles of ABA, motivation is a huge part of what we manipulate, and it's a huge part of what we use to guide our interventions. And so, when we think about different cultures, our expectations and values affect motivation. What might be motivating to me might not be motivating to you. But we can also think about it in the broader sense of what might be motivating to someone that comes from one culture might be different from what's motivating to someone of another culture. And those expectations can be very, very different too. When we think about the parents that we work with, and we work on family training all the time, we might expect something from a child because of that was the way we grew up. That's the way we experienced our world as we, developed as adults, as humans. But the expectations of that family might be very different. And we can't, go in making the assumption that that client is going to have the same motivation and the same expectations that we're going to have. And then when you think about how motivation is this big factor when it comes to being multiculturally or culturally sensitive, well, culture can influence the likelihood of an individual seeking help or treatment or buying into a specific treatment. Or intervention. And when I say buying into, are they going to actually implement what you want them to implement? Understanding, I think someone talked about this in a breakout room earlier, understanding someone's culture and being sensitive to that, and, allowing that culture to be a part of your programming and what you teach that child can really help a person value your opinion. It can really help build rapport. And we all know that when you have better rapport, it's, you can get clients and parents to implement your interventions more effectively. I think we all know that when you first start out with a family, building rapport is so important, but it's not just on that personal level. It's on this level of, I understand where your family is coming from. I understand that you value different things, and I'm willing to understand that, and I'm willing to work with you on that. Before you go in and say, okay, now we need to implement extinction. Now we need to do this. You need to stop attending to this behavior. All right, and so we're going to move to the next slide. Some other areas of importance are the way clients access services. So culture can greatly affect diagnoses and treatment. Clinicians who are not culturally aware may misdiagnose clients of different backgrounds. Studies have shown that African American boys are less likely to be recommended for treatment of ADHD than Caucasian counterparts. There's probably a lot more research I could have dove into here. But it is really important to realize that you may encounter a client who got diagnosed late because of their background potentially, or factors around their background, their culture, their race, things like that. You know, and although we don't diagnose, that's not our area of expertise, it's important to kind of be aware of that. And the fact that you may be coming into a situation with a person or a client that had a very different road to diagnosis than you may have expected or that you may have experienced in the past. And then when we look at dissemination, which is a core value of our company, but it's also a value that we all have as behavior analysts, to disseminate our information to the greater population, to let everyone know what ABA is and how great it is and how it can be used. Well, without attempting to understand a diverse population, we're not going to be able to disseminate effectively. So if, you know, we all know the importance of dissemination, we want our field to have this great, you know, reputation, and we want people to accept us and to let us help them and work with us, collaborate with us. But if we're only accessing and we're only disseminating to a certain population, and we're not bringing other people in and being understanding of a very diverse and multicultural, you know, population, then we're not disseminating as effectively as we could. All right. So this is the part of the presentation that I said it goes a little bit off topic, but what happened was I found this really great article that talked about institutional diversity and multicultural competence. And this article really spoke on the collegiate level. So they were mainly looking at college campuses. And so this could probably be its own presentation. Honestly, I feel like if anyone's interested in this topic, look at this article. It's a really great resource. So we're just going to briefly talk about it, but we're also then going to tie it into how it relates to the BACB and ABAI and their stance on diversity and multicultural competence. So on the next slide, you'll see that these authors really dove into the barriers to systemic multicultural competence and diversity. So things that prevented, and again, these were college campuses, things that really prevented college campuses and institutions from being multiculturally competent and having a wide diversity in their staffing in particular. So one of the things that they talked about is the concept and the occurrence of microaggressions in the workplace. So microaggressions, here I have a definition: brief, unconsciously denigrating messages to people of color in the form of subtle snubs or dismissive gestures and conversational tones during everyday exchanges. So again, it's not this idea of overt, really obvious racism or anything. We're not going to, you know, talk about that right now, but it's these subtle things that people say that kind of give, you know, minorities the feeling that you're dismissing them and you're dismissing their values, and you are kind of, you know, engaging in this behavior that you don't even think is wrong, but could be offensive to people and could imply that they are different and that they're on the outside of a particular group. So this, in addition to feelings of alienation and powerlessness, can lead to mental exhaustion and interference with everyday tasks. So the importance of, you know, addressing microaggressions in addition to the other barriers is that, you know, these little things that happen every day can lead staff members of minority groups to feel powerless and to be exhausted by the everyday conversations that they have with people. And that's not the goal of any institution or of any company, right? And when we look at it from an ABA perspective, it affects motivation. It interferes with daily tasks, and I'm sure it kind of decreases that person or that group's motivation to be a part of the company and to be a part of the institution and to kind of, you know, advocate for, you know, other people to be a part of that group. So again, and this article was taken discussing college campuses specifically. All right, and here I have just a little table. It got cut off a little bit. I didn't want to dive into this too much, but these are just some examples of microaggressions that can be heard kind of, again, in everyday conversations. And they're little things that when they're said, the intention may not be to be offensive, and it may not be to make someone feel less than, but they can have that effect. if anyone's interested in this article or in this visual to kind of look at it more in depth, definitely let me know. It's a really great resource, I think, for anyone to kind of look into if they're interested in this topic. Okay, great. Yeah, Lisa, just email Kat and let me know for sure. So we're looking at more barriers to systemic multicultural competence. So lack of opportunities to receive mentoring, particularly in educational settings. And this lack of mentoring can lead to lack of understanding of pay structure, expectations, and promotion opportunities. So when we think about what this means, and again, tying it back into ABA, a lack of mentoring can lead minority populations to not be able to access reinforcement, to not be able to know what behaviors will get them to the places they want to go, will get them the things that they want, will get them advancement within a company, within an institution. And then the last one they have here is tokenism. And this is any effort to or gesture to create a false appearance of social inclusion of a marginalized group. So what that means is that I'm sure we've all kind of seen, and maybe some of you might not be aware that you've seen it, but a lot of college campus brochures and promotional videos tend to include a very, very diverse population, which sometimes is representative of that place, but a lot of times is not. And a lot of times people create these videos, create these brochures because they want everyone to think that they're really diverse, even if they're not. And that really can hurt the diversity and multicultural competence of an institution or of a group of people, because it is a false appearance. And when you are a member of that marginalized group, it can create kind of an expectation that doesn't match reality. And it can kind of downplay someone feeling like they are a part of a minority group and they are part of a group that is on the outside. So when we look at how to overcome these barriers, really, these authors push for developing culture and diversity related curricula and training opportunities. So training is the biggest aspect to creating a diverse and culturally competent company, institution, group of people. And this can be on as small of a level as a small business, but it can be on as large of a level as ABAI and the BACB. So it can really be helpful to any group of people. And again, they have increasing opportunities for mentoring and increasing and supporting minority faculty. And those things can kind of overcome those barriers, get minority populations more access to the things that they need to succeed and to be more prevalent and more powerful in these settings. So when we tie kind of this idea of institutions, and like I said, it can be as big as the BACB and where we are with our organization, we have to look at the current state of multicultural competence in ABA. And ABAI has come out with a diversity statement that states the Association for Behavior Analysis International seeks to be an organization comprised of different ages, races, nationalities, ethnic groups, sexual orientations, genders, classes, religions, abilities, and educational levels. ABAI opposes unfair discrimination. This came out in 2018, which is very, very recent. I'm sure you guys might be surprised by that, but very recent. And really that's almost the extent of it. And so it is, while it is a great statement and it is really great that we're on this road to being inclusive and being diverse and accepting and opposing discrimination, we do lack in-depth policies and practice guidelines that other related fields have. So if you look at APA, if you look at the American Speech and Language Hearing Association, all of these institutions have really in-depth policies and practice guidelines that are things that we could pull because they are related to our field, and they're things that we could use to create these in-depth policies and practice guidelines within ABA companies, but then on a broader scale within the BACB and within ABAI. So it's kind of important to note that, it might be an area that we're lacking in, and which just goes to show that there's always room for improvement in the area. And that's an area that, is, I think, going to be a welcome part of of the BACB, of ABAI in the future. And I think there are a lot of people right now working towards that, and I think that's a great thing. So now we're going to move on to kind of the juicy stuff, which is, I think, what everyone came here for. So we have now, through this presentation, somewhat of an understanding of the need to be sensitive. We want to strive to be competent and to create these trainings, procedures, policies in our field in general. We understand that there are barriers and that it is important to our practice, but now what? How are we going to use this to actually implement into our behavior analytic practice? Again, so we could talk more about at a higher level how this affects places, but I know that kind of my purpose of this presentation was how we can use it every day. And one of the most important points to that is social validity. So if we look at our next slide, I'm sure a lot of you have read this article, but Wolf, 1978, was kind of the first person to really bring social validity to the light. So his article was called Social Validity, the Case for Subjective Measurement, or How Applied Behavior Analysis is Finding Its Heart. So we all know we kind of come from this field that maybe had a pretty poor reputation when it first started. I'm sure we all learned about that in our classes and things like that, but this article is one of those like oldie but goodies. I feel like you look at it and you're like, oh, 1978, not relevant, but this is really the starting point of ABA becoming socially valid and really focusing rather on, is this working the way I want it to work, or is this working for the client and for the stakeholders and the people who are affected by my interventions? And I think it's really important to note that that's kind of where that started. So Wolf breaks social validity down into three components. We have social significance of goals. Is this really what the consumer wants? We have the significance of procedures. Is this something that can be realistically implemented? And is it worth the effort? Is the extent to which I'm asking this parent or this child to go worth the effort to get the result? Are these results worth it? Or are these procedures worth it? So then we have the significance of the effects. Are the consumers satisfied with the results, even unpredicted ones? So maybe you solved the problem of them sleeping at night, but were there other unpredicted results that, the consumer might not be happy with, the parent might not be happy with? And then Cooper obviously had to go to the Bible, and Cooper's definition is that it refers to the extent to which target behaviors are appropriate, intervention procedures are acceptable, and important and significant changes in target and collateral behaviors are produced. So again, breaks it down into those three areas, really making sure that what we're doing is important and is going to be of value to the people that we work with. So moving on to again, going back to our ethical code, this topic is really important in the sense of behavior analysts are called to involve the client in the planning and consent for behavior change programs. So we should never be acting alone and deciding on our own what is important and what we should be working on for that client. It really is up to us to involve the client, and a lot of times, because of the populations we work with, if that client is not able to participate in their own treatment, then it's kind of up to you to identify the relevant stakeholders. A lot of times it's the family, the parents. We strive for this in our everyday practice. We involve families, and we stress the importance of family training and family input, and that's kind of how we utilize this every day. But how can we take it a step further and ensure we are involving families of diverse backgrounds in the most effective way? So yes, I think all of us know that we involve the parents. We do. We try our best. That's an important part of our practice. But how can we make sure that we're doing it to the level that we are able to have these relationships and get these families' opinions and have their input in a way that is really effective for everyone, especially for people who may be very different and come from very different backgrounds. So again, these kind of 5 steps are something that I personally came up with. By no means do I think I'm an expert in this topic. This is kind of based on, again, my experience working in companies that did really place an emphasis on training in this area. This is from my experience in kind of having the background of, you know, a multicultural household and exposure to a lot of these things. But again, does not make me an expert in this, but I think these are 5 things that can really help people, develop a higher level of multicultural sensitivity within their own practice. So first is something that I call honing your multicultural lens. And what I mean by this is looking at things and interpreting things with a lens of being multiculturally sensitive. So a big part of this is not to solely rely on verbal communication and standard interview questions. We really, you know, we have a lot of great standard interview questions in our field when we're doing initial assessments, when we're doing FBAs, anything like that. And obviously we do want to stick to that as much as we can to make sure that we're getting all the information that we need to. But we can also take it a step further, and we can also rely on other things, you know, outside of, and we try to always do like direct observations, but making sure that the information that we're getting from a family is not just verbal. And that doesn't just apply to the client, right? So when I say don't get all the information from the parent, I think we all know, you know, I don't figure out the function of a behavior by just talking to the parent. I observe the kid. But when I say, you know, not relying on verbal communication, not just saying, hey, parent, what do you care about? And that's all you're kind of basing your interpretations of that family on. There are really a multitude of reasons a family may not directly tell you if they have concerns, differences in opinions, or different beliefs than you. A lot of these families may have experienced previous persecution or judgment. So they may understand that they're, you know, a minority in the United States. They may understand that that their group of people may not have a lot of power. And so they've experienced this, and they try to avoid, you know, going away from the norm and going away from what's expected of them. There is a lot of times a huge desire to fit in, especially for parents and families who may have immigrated here. You know, they want to be a part of the United States. They want to live the American dream, and they want to, you know, fit in as much as possible. And that can lead them to report things different from what they actually like truly believe, or what they actually, you know, is important to them in their culture. A lot of parents or families who come from different backgrounds may have an inability to communicate effectively. And, you know, this obviously goes to just your everyday language barrier where family doesn't speak English, but it could also just be that, you know, they're self-conscious about it. I know my mom, when she first came here, she would pronounce words very differently, and people would make fun of her, and that affected her a lot. And, you know, she's in a place now where she's just can laugh it off, but, you know, that can lead to people decreasing, you know, if your verbal behavior is punished in any way, if you get corrected one too many times, then, you know, that behavior is punished, that behavior is going to decrease. So that you're not going to communicate, you know, as you might have previously. And then a lot of families, just in general, regardless of whether they come from a different background, are relying on you as a professional. So they may just kind of, if you come out with a sense of, I know what's right, and you don't, then they're going to just sometimes rely on you, and they're going to say, well, you know, she seems to think, you know, whether you come off very strongly or if it's a microaggression or something like that, they're going to think, oh, well, she knows better than me, so I guess I should, you know, just trust them and not tell them if, you know, I have a difference of opinion or if I don't agree. All right. So then we have, and, you know, and diving deeper into this, honing your multicultural lens a lot of times really involves observation. And again, it's not just the observation of the client, but it's an observation of the family. If you want to target mealtime, if you want to target prayer time, if you want to target going to church, really observing not just how the client is reacting in a certain situation, but how that family is reacting. And that can give you a lot of information as to, you know, what the expectations of that family are, what the expectations of that parent is, what that, you know, family values through their interactions with each other and through these routines that might be something different from what you've experienced. And then really trying to make questions as open-ended as possible. So when you ask a question, there are ways to ask a question that don't imply an expectation or that do imply an expectation. So, for example, if you ask a question and you say, do you care about X, Y, and Z? What you're basically saying is you should care about this. So that's why I'm asking you this question. Or, don't you want John to do this independently? So that also, again, might seem like an innocent question or a standardized interview question. But again, it's indicating a level of expectation. And, saying things like most kids do X, Y, and Z by now. I of course, know that we have to, or we don't have to, but there is kind of a level to our intervention where we try to compare to kids at the same age and try to get our kids up to that same level so that they can, get back on track developmentally and access reinforcement and access natural contingencies. But again, we want to think about, is this most kids do this developmentally, or is this most kids do this here in the United States, or most kids do this in all the households that I've experienced or that I've lived in? And instead, you might ask how a skill would typically fit into that family or in that environment. So a lot of times a really good strategy, it's not foolproof, but if you have the opportunity, would be to observe or to ask, how do other children in that family engage in this behavior? I think I want to say it was Nikki has told this story to me before where, and sorry, Nikki, if I messed this up, but, she was working on mealtime behavior, and, as she's working on it, she noticed that all of the other kids in the family were fed by the mom by hand. And so, we want to make sure that if there are other counterpoints in that family to compare to, well, if you have a typically developing sibling, that might be a good way to see, oh, how do you expect the other kids in your household to do this routine or to engage in these behaviors? And then asking, these very, very open-ended questions of, how would you like mealtime to look? What is your ideal bedtime routine? So not saying, oh, well, when is she going to brush her teeth and wash her face? Or when is she going to, when are you going to read her a book? Or when is this going to happen? Because again, it's setting an expectation, and you really want to really ask these questions of, what does this look like for you? What did this look like when you were growing up? What would make your household run more smoothly, compared to the way it is right now? All right. Okay. So the second point, I have here is learning to identify or overcome barriers. And the reason I put barriers in quotation marks is because what you may see initially as a barrier may be a key part to that client or family's life. So in the breakout room I was in, I gave the example of a client who their family valued privacy, and so they didn't want anyone that worked in the home to go upstairs to the bedrooms. But what eventually happened is that the child realized that this was happening, and he would elope upstairs in order to escape work tasks and to get the parent's attention, because the parent would say, no, like, go back downstairs. And so when I looked at that, my immediate thought was, wow, this is really interfering with their intervention. And unfortunately, I didn't end up seeing that client through, past this point. And I wasn't a BCBA at the time, I was a tech. But I would imagine, eventually if elopement and avoiding work became a really serious issue throughout sessions, that there would have to be a conversation. And it's, these conversations don't have to just be, this can't happen anymore because it's interfering with my, intervention, but it's, hey, what is important to you? Is it really important that, you have your privacy, even if you risk your kid missing half of the session engaging in elopement behaviors? And so I have listed here I got ahead of myself a little bit, but potential barriers can include prayer schedules, family pressures and interference, traditions relating to independence, habits, and language. So these things may initially seem like they could be very interfering to your session, but there are ways to work around these barriers or to overcome them. And a lot of times, like I said, it does involve sitting down with a family and saying, hey, what is really important to you? And maybe it comes down to, after you've tried all these, resolutions, and you've tried kind of coming together to, figure out a compromise, but it may then end up coming down to, hey, these two things just don't match up. I know this is really, really important to you, but if this behavior is also really important to you, we've tried compromising, it hasn't worked. We need to figure out which is more important to you and then decide how we're going to go from there. So really weighing the risks and the benefits when it comes to these interferences and these things that may be a barrier to your session or to your intervention. Brainstorming workarounds should usually involve the parents, and then utilizing these barriers into writing goals or training. Someone in a breakout room previously mentioned that they added prayer time into their intervention and they did it with the client and things like that. So instead of viewing it as a barrier, maybe it's something that you could help that client work on, and you can help that family work on to be smoother and to be less of an interference within your session. All right, so then we have number 3, be aware of your biases. I have a really good quote here. When therapists understand one's own cultural biases and cultural differences in their clients' values, beliefs, and communication styles, therapists can develop ways to build rapport and quality relationships with clients and communicate more effectively. So communication is something I think we can all agree is really important when it comes down to family training and making sure skills are generalizing and parents are able to, implement interventions appropriately. But I think it really comes down to sometimes knowing when we are biased, knowing when we view things differently than other people, and knowing that communication styles can be different, values can be different, and that's really going to help build that rapport, and that's kind of what that quote is getting at. And then rapport is especially important with families who are from a different background than you, because you don't automatically have this thing in common. You don't go into your first family training being like, oh, you look like me. You probably have the same experiences. We're similar. We have had very similar shared experiences as we've grown up and developed. Right off the bat, when you're meeting with a family who's from a different background from you, you don't just automatically have that, like, oh, you understand me. You're going to have to work towards that usually. And you're going to have to really, make sure that you understand where you're biased and where you come from a different perspective in order to build that quality relationship and rapport with that family before you get started. So this is going to be a really good breakout session. And again, this is one of those uncomfortable topics, but I really encourage everyone to be as honest as possible and to be as open-minded as possible. So what we're going to do here is reflect on your own culture and background. How may your experience bias you or has biased you in the past when working with a client in the field? So again, remember to assign or volunteer to be a group leader, and keep in mind that we have a limited time at the top, and make sure to message Kat at the end to let her know what your notes were from your breakout session.
And one more quick thing about the breakout, sorry, before we break into rooms, we have people from different companies. We have people from Verbal Beginning. We've got people from all over the country. So just keep all of your patients' privacy in mind too. Use initials. Don't give too much information to keep your HIPAA tight. All right, I'm going to put you guys out into the room now.
Right, I'm going to unmute myself. I'll go ahead and get it started. So in our group, we discussed a couple of things. One of the things we talked about was parental roles and how, there might be a bias or an assumption that both parents should kind of be involved equally, and both parents should be on the same page and both be doing the disciplining and both be, handing out reprimands or, whatever it is. So that can be an assumption. And a lot of times when you see a big disparity in parenting roles, or you see a difference in parenting roles that's different from your own, that can sometimes be because of someone's background and someone's culture. So it's important to kind of, although for your specific intervention, it may be that you need to get both parents on the same page. It's also important to do that with, the sense of it's not just a parent not caring, and you shouldn't be assuming that the parent, doesn't care or that they're wrong, but that, trying to do it in a way that's sensitive and making sure they understand why it's important, even though it may be different from how they typically do things or anything like that. Kat, did your groups have anything else that you wanted to share? Yeah.
So Kathy Judkin's group in room 2 said that they talked about one instance where parents spoke great English, but they couldn't write in English. So the BCBA assumed that they couldn't take data or write in English, or they could take data and write in English. And so it kind of created an awkward situation when they finally said, no, they couldn't. And they had to kind of get over that barrier. In group 7, there were a couple examples. Katie said that she comes from a nice waspy family. So when there's a forceful parent who tries to impose their will, she tends to get defensive. And for anyone who doesn't know, WASP is an acronym for white Anglo-Saxon Protestant. So just like very New England, nice, run-of-the-mill, stereotypical American or stereotypical white family. And so she has to remember, like, oh no, that's their normal culture. It's different from mine. It's maybe more, forceful, or the gender roles are different. And then another person in that group, Rebecca, experienced clients who really wanted their kids to say please. And that's not something that she ascribes a lot of value to. It's not super important to her. So having to keep that in mind was something she hadn't expected. Another example, members of group 4 shared that their personal experiences led to learning new cultures and adapting to new experiences. So for example, learning Shabbat prayers to support a client during family prayer times when a BCBA didn't grow up Jewish was a new experience. Or LGBT members of the group shared experiences of learning to navigate working with families who might not hold accepting beliefs of their own status. So sort of seeing the other side of the table there. We had another instance where the BCBA worked mainly with Spanish-speaking Latino families, and he got a message from them. They were speaking with a heavy accent, and he returned the call in Spanish, but they preferred English. So that kind of goes to that assumption thing that can come up so often. Sherry, also, she was in your group, and she also wanted to add about both parents. She had a case where she couldn't do hands-on training with dad due to cultural reasons. She couldn't have any physical contact. So hands-on training was really difficult with dad, but not with mom. So they worked it out where she would train mom and then also help mom to train dad so that they could still get both parents involved, which is a great example. Room 1 discussed experiencing unanticipated differences in terminology, even moving from one region of the country to another. So sometimes what we say and anticipate others will understand doesn't come across the same way. Erica mentioned experiencing unexpected differences with regard to how men interact with other men versus men with women interacting. So I guess in some cultures, she said it's expected for men to hold hands with each other, but not with women, or vice versa. And observing and recognizing those differences was really important because it's not something that you would necessarily expect. And then Brianna is going to share for her group. So you can go ahead and unmute and do that, Brianna. We want to hear from you.
Cool. Sorry, I don't know why it's not letting me paste this time. Some of the main things we talked about, because we couldn't come up with super specific examples, was a lot of being aware of the biases that you might have been exposed to that you might not necessarily agree with, but if you grew up in an area without a lot of diversity, breaking down those biases and preparing yourself for the field and making sure you're not holding on to any prejudice that other people might have presented around you. So some people talked about like their families having some prejudice, but they're making sure that it doesn't come out for them. And being exposed to different cultures when you weren't originally exposed to them growing up. Someone gave the example of working with a family that had 4 children, and the oldest child was the client, and the mom wanted him to learn how to babysit all of the siblings. So at first they were a little confused because they were still pretty young. They were only like 12. So that's not something that they probably would have done, but just kind of coming to that compromise of, okay, we'll teach this skill. We'll do it for smaller trips, and teaching the client like what to do if there's an emergency or any issues that come up. I feel like that's a big one because I know a lot of people will have different opinions on like when siblings should become sort of babysitters for their other siblings and things like that. And we talked about not imposing your own beliefs onto other families. we specifically talked about like cleanliness. So being aware of your own nonverbal language when visiting homes. So if it's not as clean as you might keep your own home, things like that, not kind of having any dirty looks or looking around too much, things like that. And just really understanding parents' roles culturally, which Kat talks about a little bit, like how it might be more customary for one parent to be more of the primary caretaker, and being mindful when we're teaching them how to interact with their child and exploring their relationship, because culturally it might look a little bit different than we want it to. And that might just be kind of a barrier that we have to look at and kind of respect and see how we can work around that. And that's it.
Cool. Those are all really, really great points. And it's really interesting to see, I think, too, the difference between our breakouts in the beginning and how we kind of saw a lot of these things as challenges and a lot of these things as difficult, things to address when we're working in the field, and how, now looking into our biases and we're further along in the presentation, really having a more, solution-focused approach and making sure that we're being aware of ourselves and our own opinions and things like that. All right. So we're going to move on to number 4, which is constantly reflect. And if, the point here is that if something isn't working, to take a step back. And we're very used to, I think, as behavior analysts, sometimes reflecting on how we can manipulate motivation, how we can manipulate reinforcement, punishment, extinction. Those are things that we, the data guides us. We're used to kind of changing things if something isn't working, but it's something we also have to address when it comes to families. So is this family, did I successfully address all of the family's concerns? Like maybe I met my goal in this intervention, but the family just doesn't seem happy and they're still not, okay with where things are at. So is there something, a concern of that family that I didn't take into consideration or that they didn't express to me? Is this intervention realistic for the setting or environment? Did I kind of set these parents up for failure? Did I make them try to do something that didn't match with what their values are, or match with what their typical routine was, or what they're used to in their household? Or is there another way I can approach this family? Have I asked all the open-ended questions? Have I, kind of tried to understand them, but maybe, can I approach it differently? Can I, ask my questions differently? Can I talk to mom by herself instead of mom and dad? Like, are there other ways that I can get to the real issue of maybe why something isn't working within a family training or within an intervention? All right. And so number 5 I have here is beware of, again, I put in quotations, research. I don't mean research, obviously, in the sense of going out and doing a study. I mean more in the colloquial sense of Googling, reading up on. So, you're working with a Pakistani family for the first time. And so you go home and you Google everything about Pakistani culture. That's the kind of research that, I think it's important to do, but there are certain things that you should use that research for and that you should not. So what that research can do is guide your open-ended questions. It can kind of, allow you to say, hey, I saw, or I know of, this particular ritual or this particular belief sometimes occurs. Like, is this something that you guys practice? Is this something that's important to you guys? It can give you more insight into the importance of a ritual or belief. If you see someone engaging in a ritual, or if a family says, hey, we're doing this type of prayer at this time, you've never heard of that. Maybe you go online to see, why is it important that they do this prayer at this time every day? To kind of understand why it is so important. And, the thing here is that what this research cannot do is tell you exactly how a family feels or thinks about something because of their religion. So you don't want to do this research, Google up on this culture and say, oh, okay, this is how they feel about this, or this is why they're not responding in this way. It also can't tell you how they will react to a statement or procedure, and it also cannot make you an expert on any culture, even your own. So I gave an example in the breakout room that I have a bias and a tendency, which I had to dig deep to be able to share this with this many people, but I do tend to have a bias where I, make assumptions about other Asian cultures because I come from an Asian background. And so sometimes I'm like, oh, well, I get it because, that's how my family is, or I understand how they feel because, this is how most Asian cultures like operate, or Eastern cultures operate. And that, that is something that I have had to kind of rein myself back on. I'm like, well, no, just because I'm Asian doesn't mean I know everything about Asian people. Just because I'm Filipino doesn't mean I know everything about Filipino people. So making sure that you're not kind of making these assumptions or assuming that you know certain things just because you looked it up or you had heard it before. So I have this little chart, and I don't know if, okay, so it's not a chart, it's a picture. It's of a textbook. I don't know if you guys remember this. This picture went viral on social media and in news articles for a while. This is from a nursing textbook, and it was published in 2014 by Pearson. It went viral on Facebook, and Pearson then had to come out with statements apologizing for it, retracting the book or creating a new edition of the book. But it's from a nursing textbook, and the purpose of it was to focus, it says at the top, focus on diversity and culture and talk about cultural differences in response to pain. But you can see hopefully right away that there's some, kind of red flags here. And one is that it groups people together very vaguely. So Blacks, Asians, Hispanics, there's so many subgroups within those larger groups that, are vastly different. And so that was kind of maybe mistake number one, is grouping them all together. And then you can see here that there's just a ton of assumptions. I mean, it's just, Jews may be vocal and demanding of assistance. They believe that pain must be shared and validated by others. And of course, these are assumptions, and these are things that could lead people to falsely, kind of assume things when working with these populations, and rather than kind of asking the questions themselves and thinking critically in a situation by situation basis, rather than kind of grouping people together. All right, so kind of the last section before we get into case examples is the areas of implementation. And this is where I break it down into the assessment, the goal development and intervention, and the family training aspects of our practice. So first, we're going to talk about assessment. Next slide, please. So when we talk about assessment, a big part of our assessments usually include interviews. So we interview the family right off the bat to get as much information as we can about that client before we start maybe our assessment with the kid. And so Tanaka, Matsumi, Seiden, and Lamb have a really great article that talks about how to perform a culturally informed interview. It's a little outdated, but has a really great, it's a really great resource, has a lot of information. So when you think about an interview, it's all verbal behavior, right? So if we kind of break it down into ABA terms, and a lot of times the client's self-report of a problem is influenced by the cultural context of their learning history. So the way that they engage in responding to interview questions, or the way they use their verbal behavior to express an issue or a concern to you, what they're saying to you has been shaped over time through the context of their learning history. So it's been reinforced by people in their culture or outside of their culture, or it's been punished by people within or outside of their culture. And all of those things kind of come together to, present in the way that they present themselves in an interview. And when we look at the interview, too, the client's reaction, what we have to think about, are the client's reactions to his or her environment similar or different from typical reactions of their cultural reference group? So when we look at behaviors to target and we talk to a parent about what their concerns are, what behaviors they'd like us to work on, we also want to kind of try to compare, is the behavior that they're looking at or that they're seeing or that we are seeing in an assessment different from what other people in that cultural reference group may be engaging in. So an example that was used in this article in particular was a counselor attempting to teach attending, tried to teach eye contact. Some of us have worked on that with our kids. And this particular client was a part of the Navajo tribe. And she came to find out later from the parents that eye contact is often taken in that culture or in their group as a stare or an evil eye. And so that ended up being something that, was a behavior that was being taught and targeted that was very different from the typical reactions of the group that particular client was in. When we look at, kind of self-reporting in the interview and the assessment, there are several studies that have shown that Chinese patients are far less likely to report psychological concerns compared to physical concerns. And some of the theories that these authors had on why this happens is kind of going back to the principles of ABA. When we think about when we voice a concern or a problem, that verbal behavior is either reinforced, punished, or placed on extinction. Either that person that we're talking to cares about that thing or does not care about that thing. And their theory here was that in Chinese culture, maybe in China or Taiwan or wherever these patients came from, reporting psychological concerns may have been something that they did but was punished, or something that they did but was not attended to. And rather that doctor or that, clinician attended to physical concerns and kind of disregarded the psychological concerns. So it could be that that person might care about their own psychological concerns, but because of how things have been attended to and reinforced in their learning history, they stopped engaging in that behavior for whatever, for that reason, potentially. And in general, what we do as people is we attend to and reinforce what we find culturally significant. So if a parent is reporting something and we're like, oh man, that is a terrible behavior that needs to go away, we're going to react in a way that tells them that, we think what they just said is important. If a parent reports something that we find to be kind of odd or something that is not of importance to us because of what we value, then we might disregard it. Maybe unintentionally, maybe we're like, oh, well, that's not a concern right now, or that's not our highest priority. So understanding that the report that the parent provides you has been shaped over time, and, your behaviors your reactions to how they report things is going to affect their future behavior in your family trainings and in your interactions with that parent. And then in an assessment, just making sure in general that you're asking about cultural background and diversity. So not making the assumption that it's not going to be anything that you address in your sessions, and making sure that you just ask the outright question, as, maybe uncomfortable or as awkward as it is. Ask, are there other languages spoken? But in addition to that, are there any religious activities that and obviously your first meeting, you might not ask all of these questions, but making sure that it's a part of what you kind of, attend to during your interview if it's something that is relevant. And just, Broadhead, Duran, and Bloom, in 2014, they did an analysis of 103 articles that came from JABA and the analysis of verbal behavior. And only 9 out of 103 articles reported on cultural and linguistic diversity of participants, which is not a lot. And this was a fairly recent, analysis, which means that in ABA, it turns out in our research from, the selection that they analyzed in this article, it really looks like a lot of articles don't report on the diversity of participants. And I'm sure some of you can remember, if you ever looked at psych articles, in psychology, the general field of psychology, diversity and cultural background is a lot of the time reported. It is very frequently reported. I don't have the statistics on that. But it's important to know that maybe in our fields, it's not something that we attend to very often, and maybe does need to be attended to, particularly in the initial intake and assessment process. So then when we, also look at the way we perform our interviews and our assessments, we really do want to avoid jargon. It's consistent with our code, but it also creates an even further barrier to families who already may be experiencing a language barrier. One aspect of kind of reporting during an assessment that was addressed in the cultural, 15 minutes left, okay, in the culturally informed interview was the idea of pathologization versus minimization. So what that means is that because of someone's background or culture, making something seem like a bigger deal than it actually is, or because of someone's culture or background, minimizing that symptom or minimizing that behavior or that concern. So I have here kind of 2 examples that were the same behavior but different outcomes and assumptions. So in this article, they give the example of a Japanese child who is in an American classroom, and the teachers refer her to assessment and special education and all that because she seems to be shy and immature and doesn't talk much, doesn't seem to have a lot of social interactions. But then when diving in deeper and talking to the parents say, no, that's how she's always been. That's how we taught her to be. That's how we would expect her to act in that situation. So that's kind of making something seem like it's a bigger deal when it might not be. And then on the reverse, you have they gave an example of a Chinese child who seemed shy and immature, but teachers made the assumption at first that that was just how their culture is, so it wasn't a big deal. But then again, diving deeper, found out from the parent that, oh no, actually this is not how we would expect our kid to act. This is not how we taught her to act. I think there actually is something that might be going on. And so that might seem like it's a catch-22, right? But I think it just goes to show that asking the parents, diving in deeper, making sure you ask these really, critical questions and thinking critically on a case-by-case basis can help avoid, either of those two things. Then we have goal development and intervention. I really want to get to the case example, so I might kind of speed through this last part, even though they're really important. So the significance of goals is kind of the social validity aspect of goal development and intervention. When we think about targets and programs and things we want to intervene on, particularly in verbal behavior, that's something that we really emphasize at our company. I have a quote here: a verbal community shapes speaker and listener behavior by teaching specific and shared verbal forms and their consequent behavior through group practices. So our behavior is shaped on an individual level, but it can also be shaped on a broader level based on the group that we come from or the group that we're exposed to. So some examples from these articles have been conversation and talking at the dinner table. That can vary across cultures. You might not want to target conversation at the dinner table if you find out that that's not something that's important to them culturally. There was something found when comparing individualistic versus collectivistic cultures, and those are cultures that either value the individual's beliefs and goals versus a culture that, and typically it is Eastern cultures that might value the group goals and the group behavior. And what was found in the Pragmatics Encyclopedia was that, and that's the Cummings 2010, the Pragmatics Encyclopedia, they found that when you come from an individualistic culture, your turns or your conversations tend to address one person and tend to focus on one person rather than the group. So it's not to say that you turn and you only talk to one person if you're in a group setting, but it's more of, well, I think, or you should do this, or I should do that, or they should do that, instead of we as a group should be doing this. Or how about let's think of the bigger picture, and you're kind of addressing your conversation towards what the goals of the larger group. Something to also consider when teaching conversation and social skills. And then we have the man and responding to the man. So, which would actually be an LR, but if, an adult demanded to a child, give me the apple, and the child hands the apple like this, they hand him the apple, that might seem like, oh, he mastered that goal, he mastered that target, that's great. But when you think about cultures who may value social hierarchy and respect towards an elder, there are certain cultures maybe where if it is a grandfather asking for an apple, that child should take the apple with two hands and present the apple to him and, maybe bow their head a little bit. And so that to that family might mean that that goal is mastered, whereas that might not be how we see it. When we're thinking about interventions, we want to think about reinforcers versus punishers, or reinforcers and punishers. Desired and aversive items can be influenced by prior experience. You might come across in the home snacks and toys that you've never seen before in your life, but making sure you're taking that into account. What is desired and aversive can be shaped by someone's culture. Emotional control and praise. I know of a couple people who've experienced this, but there are some Asian cultures in particular who really value emotional control and really controlling, how your emotions are perceived. And that can lead to individuals finding praise, and especially a lot of praise, to be aversive, whereas we typically, as ABA clinicians, love to use praise and love to give big parties and things like that. Again, snacks and toys can be different across cultures. Specific strategies like hand over hand and withholding attention, a lot of parents do find those strategies hard in general, but there could be also, kind of cultural reasons why someone does not want to engage in that behavior. And maybe withholding attention and using hand over hand you find to be the most effective and the most, important part of your intervention. So it's not to say that you should cut it out just because someone doesn't agree with it because of their cultural background, but kind of being respectful towards that and trying to understand where they're coming from and why that is something that is really difficult for them, so you can overcome that together rather than just kind of drilling it into them and forcing them to engage in those behaviors and those interventions. And then we have family training, so making sure we're engaging in regular validity checks throughout family trainings, like maybe every time you meet, to make sure that that family's culture is represented and that family continues to feel comfortable with the interventions you're implementing. Addressing barriers to generalization and maintenance while considering cultural differences. Every person of importance should be included in this consideration. So we talked about gender roles between mothers and fathers. We talked about grandparents being involved in treatment. So making sure that, you're considering the cultural differences while also trying to make sure that things are generalizing and maintaining across these environments and across all caregivers. Okay, so now we have breakouts. I think we're only going to have time for one, unfortunately. Kat, I don't know if there's a way, I have 3 different case examples. I don't know if there's a way for us to have different groups be assigned different case examples and maybe put all 3 of them on the screen, because we probably only have time for one, but I want maybe different groups to address different examples. Does that make sense?
Yeah, that makes sense. I don't have the text. I was thinking I could copy and paste it into the chat room.
Okay, yeah, that would be great.
But I don't have the slide decks. I can work on that. So let me put up the first one.
Okay.
And I'll start the breakout rooms for how much time do you need at the end to recap?
Let's do this one for 6 minutes and then maybe just really quickly at the end do a wrap up and discussion.
All right, sounds good. I'll get rolling on that. Thanks. If you want, you can always unmute your mic and we can talk a little bit about this one that's right here on the shared background about the client of Filipino background who is not able to sleep at night. Yeah, we cut it just a little bit close. Hopefully people can hang tight. I am going to put up the sign out poll. I'll write a message. All right, everyone seems to be back in the main room. To let everyone know, while we're wrapping up here, I am going to put on the sign out poll. Please just, hit whatever option you want, basically, and that just will help me make sure that everybody was here start to finish for your CEU credits. And then group 1, can somebody from breakout room 1 share what their thoughts were?
So this was my group, and we had this first case example. We kind of discussed, sorry, I'm like talking so fast. I want to get everything in, but we discussed, making sure we defined like what was, what not being able to sleep actually looked like, making sure that the parent was on the same page as you when you gave your recommendation of what not being disturbed is and things like that. And kind of asking more questions to make sure that your recommendation actually is doable. Because it sounds like if the parent didn't follow through with it, that maybe you gave them that you didn't explain it very well or ask enough questions about whether it was realistic, or maybe they agreed without really understanding what you meant. So kind of those considerations, getting more information, making sure you're not assuming and, kind of giving a recommendation that does not fit with how that family operates and how their lives are at that time.
Room 4 did this case example also, and we wanted more information. Specifically, like, is co-sleeping a component? We want to know what the current bedtime routine looks like. If there is any, if there are siblings, we want to know what the siblings' bedtime routine looks like so that we can make a model based on what is attainable for this family.
Mm-hmm. Yeah, I think that's the important point, making sure it is attainable and not making any assumptions. Did anyone do the second case example?
Yeah, that was our group did that one. So the main things that we started with was trying to figure out what's aversive about the situation potentially. Our first thought was probably that it's too loud or that there's too many people. So our thoughts there were asking the parents if there is an area that they could sit during the service where it might be quieter, maybe towards the back if there's less people. We even thought about maybe noise canceling headphones if it's really important to them. And then also thinking about what the parents' reactions are when the behavior occurs. So like, are they attending to it? Are they ignoring it? Does he get to leave, etc.? So if it's mostly related to like the noise or it being a little overwhelming, we thought about looking at exposure in other settings. So listening to the songs more loudly at home at first, with other people singing, watching the videos outside of just the church setting once a week. And then sort of just shaping up the behavior. So first they just have to sit with their head up, but they don't have to sing. Then they have to sit with their head up and maybe sing along quietly. Then sit with their head up and sing along loudly. And then it's like at church, everyone stands, then eventually standing up and singing along with the songs. I don't know if anyone else had it.
If I could make a comment about this one, this wasn't my rooms, but it is an interesting one, I think, just because at the end about wondering if this is an important priority. And I think it's interesting because, you know, in this family's culture, it may be that this is a huge part of just interacting in the everyday community. And for a lot of what we do, that's a primary goal. Like we focus on a lot of little things to get individuals prepared to be a part of the community. But if this is a major part of their community and their life and their culture, then I think whether or not we think it seems important, it is important for them.
Yeah, that's what we talked about too. Because if you think about it, like we'll teach random song fill-ins and things like that to our clients, and looking at those things, and it's socially significant to the family, and those are the type of behaviors and things that we want to work on with kids.
Mm-hmm. Yes, that's a great point. We can move on to the third one. Anyone want to volunteer to talk about the third example?
I can talk. So my group had this one, and we talked mostly about making sure we're finding out more information about who will be implementing the treatment and getting a better understanding of the hierarchy of implementing treatment within the home. So yes, it sounds like the family member is involved, and there are lots of different family members who seem to be involved in the situation. But if the grandmother is consistently interrupting the session and it's preventing progress from being made, then making sure that the grandmother can be included in the child's treatment in a way that doesn't impede on their success or the ability for the therapist to implement the session.
Yeah, I think this is one of those really important kind of gender roles and family hierarchies that sometimes we take for granted, that it's not going to be like the way that we would expect it to be. And the people who we want to be involved may not be able to be involved in the way that we want them to. So making sure that you're, again, like Colleen said, getting all the information and really understanding the family structure before you make any assumptions, and to make sure that when you do kind of address these issues, that you're doing it in a way that's sensitive and understanding of how, you know, they think things should be and how they want things to be in their family. So sorry, I know people probably had really good ideas, and again, feel free to email me if you have any questions, but you know, I have my conclusion slide that just kind of like a too long, didn't read kind of thing, what takeaways from this presentation. And I really wanted to just thank everyone for coming and for your patience with this whole Zoom thing. I hope it worked out for everyone. And thank you for your patience with me. I find it very awkward to present to a computer, so I would have much rather seen everyone in person. But I have also my references within the slides if you're interested in any of the articles that I talked about. And then again, contacting Kat if you are not a part of Rebel Beginnings and want to know more about us, more about our mission, more about our company, and if you want to get the slides or or get my contact information as well. So thank you.